Alright, prostate pathology. First we'll cover some basic principles, then we'll talk about 3 conditions. So very simple: prostatitis, BPH, and prostate cancer. So what is the prostate? Prostate is a small organ located right below the bladder, and it surrounds the urethra. So you see the urethra right here, goes right through it. Let's change our pen real quick. And the function of the prostate is to secrete a milky alkaline fluid, and this combines with fluid from the seminal vesicles and sperm, and this together, all this makes semen. And the prostate is comprised of glands and stroma. Again, you need the glands to make all that fluid, and the prostate needs androgens to function properly. The prostate glands also make prostate-specific antigen, PSA, so more glands means more PSA. And this is all pretty relevant to what we're going to discuss in a second. So prostatitis, as you can tell, is inflammation of the prostate, and is usually due to bacteria. In younger patients, it's going to be chlamydia and Neisseria that's causing prostatitis. And that's just remember, these are sexually transmitted bacteria, and it's more common in young adults because they're having more sex. And then in older adults, you're going to see E. coli and Pseudomonas. The symptoms are pretty straightforward. You get inflammation of the prostate, so what you're going to see is you're going to see some fever. You're going to see actually symptoms of UTI just because the prostate's right around the urethra, so it just gets all inflamed too. So you get that dysuria, which is burning with urination. You can get increased frequency and increased urgency. And on exam, the prostate's super inflamed, so it's going to be what you expect. It's going to be warm. It's going to hurt when you touch it. It's going to be enlarged. Alright, so the next thing is benign prostatic hyperplasia. This is a hyperplasia. Remember, this is the one hyperplasia that does not lead to increased risk of cancer. And then, so this is an age-related hyperplasia of the stroma and the glands of the prostate. And it's due to DHT, which causes the prostate to grow. And that's mainly in the transition zone. So let me tell you what that is real quick. It's the bladder right here. I'm going to draw the prostate around it. Here's the prostate. Here's the urethra coming through. Prostate surrounding the urethra. And then here is our transition zone, right around the urethra. It's also the transition zone. I'm also going to draw out another zone. It's called the peripheral zone. I'm going to label it P. Okay. So if the transition zone, if it grows due to that DHT we're talking about, you can see that this urethra gets clogged up. It gets compressed. So guess what symptoms you're going to have? First of all, it's going to be urinary symptoms, and more specifically, it's going to be obstructive urinary symptoms rather than the irritative symptoms of UTI. So obstructive urinary symptoms include incomplete emptying, straining to pee, dribbling. This is all because this urethra is well blocked up. So just remember, obstructive urinary symptoms. All right, and the treatment is pretty simple. Treatment is alpha-1 antagonist, so that's like tamsulosin, terazosin. And what do? They relax the smooth muscle. So you get smooth muscle relax, and so your urethra widens up again. And nice, no more obstruction. The other thing you can do is give a 5-alpha reductase inhibitor. What does 5-alpha reductase do? Remember, it takes your testosterone and turns it to DHT. And do you remember what that DHT does? The DHT is what causes the growth of the prostate. So if you have less DHT, you're going to have less growth, so your prostate decreases in size. The last thing you can do is just do a surgical resection. And so you can, let's see, you have this overgrowth of prostatic tissue. You can just go surgery and just remove all this tissue here. And again, you have a nice wide open urethra to pee from. Okay? So finally, we're going to talk about prostate adenocarcinoma. This is the most common cause of cancer in men. It's usually older just because as you grow old, you get more risk for cancer. It's a very slow growing cancer. And this arises from the peripheral zone of the prostate, right here. This is the peripheral zone. And so what symptoms? It's actually usually asymptomatic because, let me draw out the rectum right here. This is the rectum. The prostate will grow. Cancer grows out like this. So as you can see, the urethra is untouched. But what can happen is it can metastasize to the lower spine. This is key. So patients will present with low back pain, and they'll have increased serum alkaline phosphatase because of the bone breakdown. And prostate cancer loves going to the lower spine. So if you ever have an old patient with low back pain, worry about prostate cancer. So how do you diagnose it? You start with getting a PSA, the prostate-specific antigen, which is released by prostate glands. And but I have to emphasize that this is just a screening test. Okay, so if the PSA is elevated, that doesn't mean you have prostate cancer. There's other things that can cause it. Cause increased prostate glands. BPH, for one, has increased prostate glands, so increased PSA. Prostatitis also increases your PSA because it induces release of PSA. So you can also just check with physical exam. You can just take a finger up to the rectum, and if your prostate cancer is big enough, it's going to impinge on the rectum, and you're going to be able to feel it. So if you suspect prostate cancer, your PSA is elevated, you feel a nodule on the rectum, you got to get a prostate biopsy. And you can grade the biopsy results with the Gleason score. And this is actually based on the architecture. It's not based on the presence of nuclear atypia. So this is a little different from most cancers. And you're there's a bunch of patterns that you can see on the biopsy, and you're going to take the two most common patterns that you're going to see, and you're going to score it from 1 to 5, with 5 being the worst. You add the two scores together. So let's say your most common pattern is 4. So it's grade 4. Second most common pattern, let's say, is a grade 3. Then your total Gleason score is, guess what, it's a 7. And you can actually have maybe most common pattern is a grade 4, and second most common pattern is also grade 4. And that's an 8, which is even worse than before. So that's it for the prostate pathology.